Morning, good evening, good afternoon, everyone. A very warm welcome to everyone in this another special episode of Expert Conversation by Elderly Care India and 50 Plus Assist. I am Dr. Mrigna Pankaj. Today's discussion is one that touches every family, every home, and every future, including my own. So today we know we all are growing old, and growing old is something universal. But growing old well, with dignity, with access, with the right medical support, unfortunately, is not. So today we're talking about geriatric medicine, its acceptability and availability, affordability in India. And with me is my co-host Pankaj. Pankaj waiting on to you.
Thank you, Dr. Mrigna. And it's a pleasure to again be back on the podcast and have our special guest today. Today, I would like to actually uh, thank Dr. Prem Narasimhan, who has kindly accepted to come on the show. Dr. Prem is a leading geriatrician based out in Mumbai. He is the chief consultant geriatrician as well as the founder of the Department of Geriatric Medicine at Jaslok Hospital. When the department is the first of its kind in South Mumbai. He is also the founding member and the director medical services with the platform called the Wisdom Club, which is elder care ecosystem. And as being the founder of the Wisdom Club, he strongly advocates and strives to promote the concept of continuum of care. Lastly, he has been a great knowledge supporter of Elderly Care India, and we've really been benefiting from his experience and guidance. So, welcome, Dr. Prem.
Yeah, thanks. Thanks for your kind words, and it's great to be on this platform.
So, Dr. Prem, you have spent your years advocating for active aging. In your experience, what are the biggest challenges that India is facing today when it comes to awareness, advocacy, especially in geriatric care sector?
Uh, I feel, it took quite a bit of a sort of while for people to even realize themselves that there is actually people getting old. We have always been professed world over as a young country, but we have not really professed on the fact that we have a population which is aging. And the aging population is very heterogeneous. We are having a population which might need a lot of help, and some people who might not need a lot of help immediately. But whether you call it the silver tsunami, I see it more like a silver lining because we, as such, have not really ever utilized the human resource, biggest human resource which we have world over. It's not India, and that's older adults. So the fact of the matter is we are failing to a great extent even trying to. So I think, and but I would focus on the positives and maybe then the challenges. We have always been a society which has respected old people. It's not that we haven't, whether it's our parents, whether it's our grandparents. It it has been out of love. As generations have obviously changed. Earlier, maybe it was a different where we obviously couldn't maybe. Earlier generations there was too much of respect and there was not maybe a lot of talk, but there was always love. What has happened is the challenge which has happened is not even we are not even aping the West. It's just automatically happened that there is no joint family system at all, hardly any. So it's all nuclear families, and it's not only the major cities. It's happening even in the towns. It's happening in the smaller places. Now people are moving away to bigger towns from even villages to work. So technically, they are not living with their parents or grandparents. So that automatically is creating a vacuum of care. Now, second challenge that we are actually having is, I think, human resource. We can keep talking about older adults, they are going to increase. We can keep talking about the challenges they will face. But until unless we increase the human resource, according to me, a human resource, whether it's doctors, whether it's geriatricians, whether it's physiotherapists, whether it's nurses, whether it's caregivers, I feel professional caregivers who are going to take care of, or as we call them, nursing assistants, could be the GDAs that we call. We will need a lot more of them. And the key is we already have them, but how many are trained? So if we have trained, skilled workers who are wanting to come and tell me that, no, I want to be in the elder care space. I want to be motivated to take care of older people. Then another thing, challenge is I feel that we keep thinking that people have to naturally want to maybe serve older adults. I don't think that is always the case. You have, obviously, you have to have empathy. You cannot be a person who is absolutely sort of very rude to older people and then given the skill. But if you have a general sense of empathy, the skill of caregiving or the skills that I talked about for various facets can be provided. And I think the third, and then maybe the fourth one, which I'm saying is one of the very important things, maybe is to an extent the lack of insurance coverage in various sectors, especially in elder care. I mean, for a person who has delved into assisted living, who believes in continuum of care, uh, I will quote Canada and to a great extent a lot of parts in the US as well, wherein Medicaid and insurance does take care of care out of hospital. Whereas in India, it's not really come in. Yes, the government has been trying to sort of do well through the Ayushman Bharat, which has had its advantages. But again, it's not like one size fits all, which we all the three know. For older adults, the most heterogeneous population, so you have to have different sort of ways of doing. So I think training is very, very important. Human resource is very important. And finally, I feel the older adults themselves, they have to sort of understand that they can do much more. Not everybody is still in the thought process that, no, I'm old, so I can do much more. A lot of people still think that maybe I'm not, since I'm old, maybe I cannot do a lot of things. A lot of startups are working very hard where people are actually getting jobs even later. Now, the experiences of them has been that them being used as they go ahead, they are not really, once it comes to working again, they are not very sure. So they have worked throughout their lives, they show the interest, but they are a bit, maybe they are not very sure whether they should continue to work. Or I feel we as a people who are in the elder care have to take the initiative of spreading knowledge. I think that's one of the biggest challenge. We cannot expect people to just know about geriatrics, know about elder care, know about us, know about what facilities they have. I mean, if you ask the older adults how many schemes of the government are there for them, not everybody is going to be able to tell that also. There are two reasons. One is, of course, whatever schemes are covering, the maybe the amount of money is very less. But again, I mean, that's different for different people. But not knowing what schemes you have itself is sort of, so I think we have to do a lot as far as in these particular challenges is concerned, and the onus is on us. I feel. I mean, we cannot just put it on government. We cannot put it on maybe some other sectors. And one of the biggest things I feel is we always tend to think we can do everything ourselves. In elder care, you can't do anything alone. You have to have partners. You have to have people. You have to have a multidisciplinary team. I mean, that's the ethos of geriatrics. And if you have to take care of older people in all levels, you have to have more and more people. So I mean, that's what is the most important thing about it.
That's a very valid point if you see, Dr. Narasimha, that actually we feel elderly as one age group, but they aren't. They are one of the most heterogeneous population that exists. And the needs that is for a 60 to 70-year-old will never match with the need of an 80-year-old or a 90-year-old individual. So considering that it's such a heterogeneous population, how do you think that many families, still believe aging problems as normal, ये तो बूढ़े हो रहे हैं या ये सठा रहे हैं. Words like this is used in India, very commonly. So how uh, how do you think we work? First of all, my first part of the question is, how do you think this kind of a mindset works for seniors? How degrading it is for them, or how it works for them? And the second part of the question is, how do you think we can work to change this kind of a mindset? As we've spoken about, that the onus comes to us by the end of the day, to make the awareness, to make the changes. So how do you think we can change this mindset for older adults?
Yeah, so I think, I mean, the reason I was telling that is because you can always keep talking about change, but you have to be the change. I mean, you cannot keep professing something which you're not wanting to do. And I think, I mean, Of course, it is. There are so many myths like all older people will get dementia, all older people will be depressed, all older people cannot learn things. I mean, it's quite hurtful. But I feel the on the positive side, older adults are very thick-skinned. They have seen everything in life, ups, downs, family, friends, financial, uh, health-wise. Uh, I think they have I mean, they have brought up families, to be very frank. That generation we are talking about, maybe who is maybe a centenarian now or who's 90s now. I mean, centenarian has these two pandemics. I mean, can you imagine? And one famine, a world pandemic, a famine in India, and independence. So many things. So they have overcome too much to even sort of get perturbed by the fact that you're too old, कि आप बुड्ढे हो गए हो. But the fact of the matter is, from ours, the onus is to keep encouraging them, and it's a proof of the pudding. There are so many examples. I mean, during the pandemic, there was, I think, one older adult who started the Burfi business. I think she was from Punjab. So she basically took the help of her relatives. I think it was her niece or somebody who sort of was able to spread it. So, I mean, she started something very late. I mean, world over, you have Kentucky's Fried Chicken. Although, I mean, I'm not sure how healthy it is, but it was a person who actually took the initiative after 75. I know of an older adult very close who did I mean, we all know what gerontology is the study of aging. So they basically did that degree after 76 and he was top of his class. So the fact of the matter is the older adults just need a drive, and I've always heard this, and I might profess this as when they get up every day in the morning, they need a purpose. So it's our job to give that purpose. So whether the purpose is actually giving back to the society, it could be voluntary, whether that purpose is actually working with us to make sure that they are professing healthy aging, whether that is to work in whatever they want. I mean, they don't even need to work in the same way they were. I mean, they don't need to do the 9 to 5 government job or whatever they were doing before. They can do something else. We have to make them the beacons. So when they are the beacons, they obviously sort of take it. Now, I mean, this is the era of social media. So why do you think that an aging influencer cannot work? I mean, are already a lot of, I mean, we have one of the biggest actors in our history, Mr. Amitabh Bachchan. I mean, his voice is still heard of in Kaun Banega Crorepati and and all age groups. I mean, people who have not even were not even born when he was maybe an actor are very much in touch with him. So I think there are so many examples. Of course, he might be a celebrity, but there are so many examples of determination wherein people are ready to do. So I think it's our job to highlight those stories, but at the same time, make sure that people who are not respected or not able to do it are encouraged. Because I think I mean, health is a state of physical, mental, and social well being. A person can have all the money in the world, maybe physically fit, but nobody to share with and lonely. So that's where. And another concept which I really like is fitter older adults should help other older adults of any age group. I mean, a 95-year-old who's fit can obviously help a 75-year-old. There is nothing known as an age gap there. Similarly, I mean, companionship is also so important. I mean, we are in a day and age wherein older adults would love to have a companion maybe after losing their life partner. Why not? So even that is something which should be encouraged. So and I'm telling you, I mean, India is in such a phase where people are thinking a lot. I think the real tipping point was the pandemic, wherein people really sort of thought elder care in a different way because children suddenly realized that we want to visit our parents, grandparents, but we can't. We have the money to book the ticket, but we are not allowed to do it because of the travel restrictions. And that is when everybody thought. So I feel a lot of times, if we have a personal story, whether it's a positive, negative, that should be good enough for driving us. And all we need to get is a set of people who obviously have that equal motivation. But the hero or the heroine should always be the older adult because that's what we are working for.
Oh, very well put, Dr. Prem. And just to respond to what you said, that a 95-year-old person, why can't he help, or he or she can help a 75? I'll give you a very real example. A very dear friend of mine, in fact, my roommate, he's based in Pune, and his mother is 90 years old herself, I think 92 now. And from the past 15 years, she has been going to people's houses to help them. And even at the age of 90, she was going and giving support to other older people. At the same time, going for these afternoon cards club and afternoon tea parties, which is very encouraging. And she's a very frail lady. It's like she's a very average height and a very uh, frail person. But it is the mental strength, I think, and the mental spirit outlook, which is very important. What you say, which drives the aging process. So my next question to you, Dr. Prem, would be, since you have been on the ground and you have been interacting and you have been in the industry for such a long period of time. So how does the elder care ecosystem work in India, both from the residential perspective, which I mean the independent assisted living and the nursing care part of it, as well as the hospital aspects, and the second is care at home perspective, because I see a very strong divide that okay, this is care at home services and this is residential care services. So, what are your opinions on that?
Yeah, so I think, I mean, you have sort of put maybe all the gamut of services which are usually there for older adults. In fact, they can be taken care in all these levels. If you want to add another one, maybe that's the community, but that usually has older adults who are fitter. So they will be more wanting to be busy, trying to do a lot of things, enhancing their quality of life and being continuing to be independent. But a lot of times the trajectory could be when they are fit, when they're unfit, they obviously have to get admitted to the hospital. And then there was home care, which is always there because doctors used to visit. I mean, as a geriatrician, I do home visits too. But what has actually evolved now, or the ecosystem which has really evolved, is by the completion of maybe two things which have really added up, and that would be independent living and assisted living, because independent living has gone over the roof, I think, recently. I mean, down south, up north, even in Mumbai, even in Maharashtra, it has actually sort of come up. A lot of players have come up. The players have been real estate people. They have been a mixture of real estate and medical people. So it's been a mix and match. In my case, of course, Wisdom Club, which is an assisted living facility, we are, of course, I mean, I am, of course, the sort of the geriatrician, but we have a varied. We have a neurophysiotherapist. We have somebody from the background of hospitality, and we also have somebody from the background of diagnostics. So, but with a common goal of actually getting into this. So, the biggest, I would say, and of course, independent living, before I talk about assisted living in detail, is that people are now choosing themselves. I mean, I know a lot of older adults who are choosing themselves, and not only they are choosing themselves, they are paying for themselves, going into that independent living, thinking that what am I going to do? And maybe they might have a 4-5 bedroom, nice bungalow up north in Delhi, but they are like, what will I do? I mean, we all know with safety issues in every, I mean, metro, forget Delhi for that matter, just living, you and your wife or husband living with servants day in, day out, and with whatever newspapers we see, it's always the highlighted of all the crimes. But security one, and then companionship, the fact that they are able to go, so they are taking that decision. And a lot of times they're not even depending on the children for the financial part, because they want to sort of independently do it. And that is something which is a very interesting development, purely because real estate was always thought for people who will get into it, grow into it, and then sort of maybe grow old. But people are taking up real estate when they are old, deciding, no, we want to sort of be in a community, and retirement community is very much there. Now, as far as assisted living goes, it's a bit more complex. By that, I mean, because you can have people who need various levels of assistance, and you can have specialized care. Now, specialized care will be palliative care, memory care. I think memory care is one of the huge things. There is a huge need, there's a huge demand. I'm not very sure we have still reached where we are able to sort of cater to everybody yet, purely because we need more specialized dementia centers. We have a few in India, but the fact of the matter is we are still reaching where we need to have something, a proper center wherein only dementia people are taken care of in the best possible way, as we have abroad. And we'll get there. I mean, see, as far as assisted living is concerned, the misnomer or the synonym which people mistake is with old age homes. And old age homes, unfortunately, has a very negative connotation. Nobody to be blamed here, purely because whether it's social media or whether it's the existing old age homes which are not really, I mean, they were earlier, to be very frank, some of them which I have seen have been pretty bad earlier. But government runs also are not bad. I mean, people have NGO support, there is companionship, but they have their limitations. But assisted living has had different levels, and people, there are premium ones, there are middle budget ones. So there is a variety in that space as well, which was maybe not there. Now, the challenge for us is always the social stigma with it. People might want have the money, people might have huge caregiver stress, but the fact of the matter is that people are questioned even by society, like, how can you do this? How can you keep your parents or grandparents or whoever into the assisted living? So that is something we have to help them, because I always tell them that maybe caregiving is getting difficult for you at home. So what you're doing, you're taking a decision about it and you're not sitting on it. You're taking a decision that I know that somebody better can take care. But yeah, I mean, that guilt is there. So we obviously have to help them get over. Now, just briefly about hospitals. Now, hospitals have warmed up a lot. Maybe when I entered as compared to now, I have a maybe an experience in both setups because I was in AIMS as well before, AIMS in New Delhi, and also, of course, in the private sector as I am now. So I would say that in the government sector, also earlier less colleges were there, but now when I was there, I think an MD program was there maybe in 3 colleges. But now the MD program is there in 25 colleges. It's increased, but it's not enough. It's hardly enough. The number of seats are not much. And the overlap which happens with geriatrics sometimes confuses the hospitals. But I feel geriatrics as a specialty is always adding. It's always adding on to whatever others are doing. And it actually helps the hospital in giving specialized care. So, and it gives a very different dynamic wherein outpatient department, admissions, ICU. There is also a geriatric emergency service now, wherein you have to take care of older adults properly in the emergency so that they are triaged well, so that delirium is taken care of well. And of course, abroad, there are geriatric specific ICUs as well. Now, I mean, unfortunately, we are not able to always get those ICUs in India. I mean, you have to have good amount of lighting. People have to think about in from planning stage. I mean, you cannot go into geriatrics. Like I am a part of, I was a part of a guidelines for dementia friendly hospitals in India. So as simple, I mean, people with dementia not necessarily might be not able to read. So just marking it as sugar and salt will be enough. But sugar and salt look same. So the mixing happens when it is not marked. So small things like that, like marking is the toilet, encouraging them to walk. So I think we are getting there. So the importance of geriatricians is also getting there. But again, the onus again has to come on the geriatrician per se, the group of geriatricians, to make sure that they are able to drive the initiative. Because ultimately, when you are a geriatrician, you're not only making a health change, you are actually making a social change also. And to a great extent, you're able to even make a policy change. So I think as a geriatrician, you are in a very unique position wherein you can work in all levels, which is not always with every specialist.
Essentially, we understand
So
that how geriatrics have adding on to the value to all the fields and, essentially the whole ecosystem of the hospital. But let's talk about the medical fraternity part of it. How popular or unpopular you think is geriatrics care as a specialty in India today? And do you think young doctors especially are discouraged choosing geriatrics?
see, I think it's only improved. They say they always say ignorance or not knowing something about always scares people. So I mean, you have again. I'm putting it again and again. The onus is on the geriatrician to make sure that they understand what you do. Nobody else is going to. I have had an experience where people who are trained abroad, so they are actually older doctors. They are in their own geriatric age. They know a lot about geriatrics, and because they were trained abroad. So I have had a lot of consults from the veteran doctors because they understand that geriatrics is very important. And the younger crop is also warming up to it. But the fact of the matter is, it's proof of the pudding. I mean, how would people understand by you just saying that I'm a geriatrician and I have come to add value to whatever you're already doing? So we have to go, and obviously, I mean, a lot of conversations. I feel a lot of sensitization. That is the key. A lot of lectures, a lot of understanding for the older adults themselves. Now, the simplest thing which tell always is like how pediatrician is for kids, geriatrician is actually for older adults. So that's a good parallel to give, because geriatrician per se sometimes can, I mean, put people down. I mean, in Hindi, it's even more difficult. Actually, it's Jara Chikitsa, and that was the department name which was put in AIMS as well. So people obviously did not understand. So we obviously made it a bit more simpler. And now we don't even call elderly anymore. It's older adults. So WHO has even taken out because it's a negative connotation, and focus is more on elderly and not really elderly, and it's more about older adults. So, and specialities like surgical specialities, I mean, especially orthopedics, then there are neurological, then even oncology. There is so much of sync. So when you actually work together, then the quality of life and independence only helps. So all we need to make, I mean, what I have also tried and spoken to so many doctors is everybody loves their patient to get better. I mean, there is no two ways about it. So when that value is obviously understood, they obviously tend to get it more popular. Now, as far as young geriatricians or young people are concerned to take up the specialty, I think this is the specialty of the current and the future. You know facts, it's facts. People are getting older, people will need more and more help. So you will have to get trained enough to help them. But my only advice to young people is do not think future when you are taking the MD. You cannot think of an output of a specialty once you're entering it, because 3 years is a big time. World changes. I mean, there is a demand for geriatricians in assisted living facilities also. Earlier there wasn't. So the world keeps changing. So if your focus for young doctors should be to understand the trade in those 3 years, to make sure that you're so good enough that once you come out, you actually are encouraged to do something about it. And I mean, the up team time, I have told it, the onus will be on you. Once older adults are convinced, they are with you forever. I mean, that's my experience with that older adult age group, because once they understand, you give them time. Geriatricians always give time. You give them that utmost care, you give them a comprehensive care. You understand that a lack of caregiver is as important as hypertension. You understand that a family member not being there at home for the next 10 days and you being isolated is as important as an admission in the hospital. Prioritizing what is important today and making sure that what can get better for the future. So geriatrics is usually a life course treatment care. It's not at that particular time. To I mean, how we stand out is to understand that this drug started today is going to be a problem 4 years down the line. So it's better that I don't start the drug or I stop the drug is much, much more important than only focusing on the medical part. So I think it's as complicated as it can be, elder care, but if you break it down, it's very simple, because older adults just need time. If you give them time, you are able to solve their problems. But if you don't, I mean, this is a direct sort of, I think, maybe a message to the young and budding doctors who want to get into geriatrics or medicine in general, that time is the most important. The lesser the time you give to a person, the lesser you'll be able to learn, because ultimately you're learning from them. That is something you have to understand.
Despite the challenges that we spoke about, when the onus of explaining the profession itself comes onto the doctor, what keeps you deeply committed to the field or deeply motivated?
I think it's the older adult. I mean, I can't even imagine the amount of blessings I get. I mean, you have grandparents, you have parents, everybody has that. But I have so many people. On a daily basis, I'm seeing families. You get blessings of families. You don't even guess. In which profession do you actually continue to get blessings after the older adult is dead? In which profession do you get the chance to actually guide a person during their last days? So that's why I say it's a life course till their death. So once you are taking care of an older adult, you are taking care till they die. and to benefit an older adult during the last stages of life, whether it's making them pain free, whether it's letting them eat what they maybe couldn't eat before because they hardly have days left. The fact that we are able to enhance their quality of life, where care is more important than cure, I think that's what is really motivating. And ultimately, I feel, I mean, it even shows in the name of the, I mean, I would want to highlight Wisdom Club purely because the wisdom part. It's the wisdom that we have got, or I have got from them. Whatever I know is from them. So that's why I always tell, I mean, everybody that my wisdom will be much more because it's not from me. It's been gained by older adults throughout their life course. So I think that's the key for me. And an older adult, I mean, if they, I mean, I feel even if they're able to cry in front of you, an older adult who might have not even cried, that means they trust you. So that's what I'm trying to highlight. And you get a lot of satisfaction. The satisfaction by that means, unfortunately, you lose people. I mean, I know I'm going to lose a lot of the older adults, but that's a fact of life. I mean, we all lose people throughout, but look at from their perspective. They lose friends, they lose family, they lose maybe a position which was created in their work, but they continue to go on. So what stops us from actually going on to make their life better? And I mean, we all have had maybe so many stories on how maybe you're having a bad day, but a small thing which you have with an older adult just completely changes. And you're like, what problem are you talking about? You just had a bit of traffic today. I mean, the older adult who might have a something, but is still ready to wait for you to talk to you because they know that we can make them feel better. So, as I said again, if you want to make a change, you have to be the change, and you don't get that. I will keep repeating it that as a geriatrician, you are able to work in different capacities and you are able to be a friend, you are able to be, maybe they might think you as a grandson, they might think you as a son, uh, you are able to counsel relatives, uh, we are able to take care of the caregiver. Remember, it's so important to take care of the caregiver. It's very, very easily lost in all the older adult focus that we have. Of course, the caregiver might be a 75, 80, 95-year old themselves, but younger people also, I mean, they also have their families. I have seen families just not having time for themselves because care becomes so important because they want to take care. But I think the biggest thing is satisfaction and the blessings. And I think you don't need to ask for it. You just get it. I mean, where else do you do? Where else do you? It's like the best profession to be.
No, I think this was very insightful, and I completely relate to you because 2 months back, I'm just giving you an example between a regular physician and a geriatrician. Firstly, my mother was not feeling well, so we took her to a reasonably leading hospital in Noida. So they have this pamphlet of this facility, this specialty, that specialty. So almost like some 200 doctors are there on that. But definitely there was no heading called geriatricians or geriatrics. That is number one. First, we went to gastro. He took around 5 or 6 minutes, and within that, he made my mom cry because he was so straightforward and so pressed on time. And then we again saw another doctor. He said, "No, no, you go and see to the cardiologist." Cardiologist said, "No, no, everything is fine. You get these tests done, that is done." And another 4 5 minutes he probably spent on her. Then they referred us to a regular physician. She was definitely a little more understanding. She gave around 8 10 minutes, which was a very big time for her hospital. And finally, nothing happened in terms of, because from the crying stage or very first event to all the tests and a battery of tests, someone suggested, "Why don't you go and see this particular doctor?" He was definitely a little more aged person. He gave just 5 minutes extra than a regular doctor. He himself was not a geriatrician, but just because of his
Mhm.
experience. So now my mother is saying, "No, no, no, no. I will go to Noida only from Delhi and meet him." So she's become a lifelong fan of him. That no, no, no. He spoke to me politely. He tried to understand my thing. And it's just a matter of that another 5 minutes. It's not that he spent the whole day or anything. So the first time he spent that extra 5 minutes, the next time obviously he knew, okay, okay, this is a case study. Mataji, aapne ye kiya, ma'am, have you done this? And she came all smiling. So I think yes, that part is very, very important. What you are saying. So coming from the same perspective at a national level, what do you think? What are the policy level interventions which are required at the national level, which can bring in aged care or elder care on the driving seat? And what is the kind of service delivery you think should be done both at the government level and at the state level, the central and the state level?
Yeah. So I think, I mean, as you were saying that example, I just thought maybe I'll just add one line that, of course, time given to an older person is never time lost. So it's as simple as that. The more time you give them, the more you are able to sort of help them in their problems, and that's why we are in that field. And I think a lot has actually happened in policy making also. It's just that governance sometimes is slow, and I think it's in every country. I mean, let's not just keep saying that India is slow. World over, it's slow. I mean, it's not as if, I mean, or else we would have been only talking about how geriatrics is abroad. I mean, that's not what we are talking. Even the NHS system is crashing down. So it's not that everybody is perfect. But the most important thing I feel is like, of course, I think Ayushman Bharat was a right step. I'm not very sure whether it's the only step which should be taken. Uh, I think there are a lot of policies like the national policy of healthcare of the elderly. It started in good earnest. It has established a lot of departments, but we keep saying that there has to be upgrades. You have to upgrade policies too. So I think that's why more and more people, and in fact, I think it should be not only people from the government sector, it should be government, private sitting together along with social organizations and people who are not even doctors, non-doctors, everybody should come together because you are trying to take care of the most heterogeneous population. So it needs an ecosystem. It doesn't need just one faction. Like only the Ministry of Health is not going to be good enough. It has to be everybody. I mean, health and family welfare is and social justice is usually who takes care of everything, but that's not what we only need. I think some states have done a good job automatically. Like if you see Kerala as a state has always had older adults uh, who, I mean, they've always had older adults as a population. Policy wise, they are working. More and more things are happening. The fact of the matter is, we also have to look for stories. A lot of good things are happening actually in the interiors. We don't even know about it. I mean, I know I mean, I'm not remembering where exactly, but I think there were a group of workers. Basically, I think they were ASHA workers or they were just caretakers in one of the villages who are actually been conducting companionship for years together. But we don't know. We don't know because and they sort of took that onus. They got trained online. Again, see now the technology is something which has really come up. Then another thing which I have to give the government is we also have the startup, the Sage thing which has come up, wherein at least the startup funding sort of there is an encouragement. See, ultimately, how do you get ideas? How do you get ideas who are going to sort of get into execution? Is obviously by encouraging the fact that no, if you think about this sector, you're obviously good. I mean, let us be very frank, the elder care is an industry now. It's no longer just elder care. There are a lot of people who are looking at think people are living long. Even longevity is a very big thing wherein people want to live long. A person who's a 30, 35, 40-year old wants to do X, Y, Z to live long. And the reason is because maybe we have not been doing things rightly. Whereas people who have lived till 100 obviously did something right throughout their time. Whether you look at I mean, why are the blue zones there? It's not because the governments did job there, not necessarily. It's just that the people themselves did a very good job. But yeah, locally we have to do a lot of things, I feel. I mean, as basic as is our travel friendly for older adults? Public transport. For example, even now when you take a bus from a bus stop and an older adult has to get into the bus, there is still a significant height difference. So there has to be an automatic ramp coming. I'm just saying it should be wheelchair friendly. So why should we feel that a differently abled person should not travel in public transport? I mean, that's not something which should happen. Metros are coming left, right, and center. I mean, Delhi has good metro. I mean, it was one of the pioneers, I would say, initially in India, and it helped a lot. But everybody has the personal choice of cars. Obviously, traffic is something which is unavoidable throughout the world. I mean, India is highlighted always, but it's there throughout the world. So the fact of the matter is public transport, trains, planes. I mean, airports are getting better. We should not say there is a huge stack of wheelchairs. Earlier, I mean, if we would have all traveled, it was not as elder friendly as it is now. So things have obviously got a bit better. Then state wise, I think the southern states maybe are a bit more ahead. Very simple. I mean, they say sensitization, education is equal to development. 1996, the first Department of Geriatrics came in Madras Medical College, Chennai. The first Departrix came in, for example, in Mumbai only in around 2012, 2013, maybe 15. So it took its time. In in overall world in 1996, there was an article in Oxford University Press saying that we need more geriatricians in 96. That article came here in 2021, 2021. So we are getting there. We are 25 years a bit later, but in India doesn't follow what happens in the West. India develops much more. So we are a growing population in that way. But I feel the ideal way of changes in state and central will be only when people of different areas and different factions sit together and make policies, rather than only people up maybe. I mean, usually a lot of times up north, what happens? People only in the north are meeting. I mean, that's not really a national directive. You need to have people joining in throughout and take up issues. Like dementia is a very important thing. There are so many people who are having dementia, having more and more dementia clinics. Announcing clinics has been happening for a while, but are they there in the ground? Make sure that WHO has got a very beautiful ICOP, which is a tool. So more and more primary physicians should know when to actually refer. I think that is very important, because a lot of time detection only doesn't happen. If detection is not happening, how do you sort of help? I mean, kudos to primary physicians. There are so many tales where people actually do a great job. I mean, it's not even highlighted because they don't go on saying in social media that I'm doing this, but they're doing a great job. So encourage them, and they have a very good connect with their older adults, with the families, because they are the ones who are going to home. Very good work happening in palliative care, especially again Kerala being the center, because there is where it started. It's percolating throughout India slowly and steadily. So that is also something which is very important. So I would say always get all the stakeholders together for policy making, rather than make the policy and then take advice. I mean, sometimes it becomes difficult to make wholesale changes. Sometimes it's more driven on agendas that we need to release it. So I think if we can sit across and make better policy, it will only be better. And of course, as they say, it all starts at home also, like how you're doing. If your older adult is actually telling you that uh, teach them Zomato, and this is for people younger than me, don't order Zomato for them. Teach them the app. They are not going to ask you later, because once they learn things, they do really well. So a dialogue should happen, but with action. I don't like people meeting, having a nice time for half of a day, but there is no paper coming out. So there has to be something which comes out. So there are organizations like VI Vikas who actually have stakeholders meet, and they get it to a paper within a week, and they put it across to the government. So when that happens, at least the pressure is there from our side, and we really have to work on the pensions. I mean, we know how inflation is. We know where we are and where we were. I mean, the pensions are so minuscule. We have to, I think, work on that also, because ultimately, not everybody will be able to have a second job or continue to work. I think, and from a policy making thing, encourage older adults to make living wills. I think that is something which is very important. Encourage them to have their own financial independence and then help their children, and not necessarily think of just giving everything to the children purely because I think that's what matters. So these lot of education has to happen from a policy making also, and I think some, as politicians, as governance, I feel they are addressing a huge amount of crowd. So if they're able to do the change, obviously will be much more as compared to maybe a person who's not even addressing those crowds will have. But we are
Well
getting
said,
there, but more work to be done.
yeah. No, well said, Dr. Prem. Actually, very valid points. And especially coming to things like living will, that, In fact, last night only I was talking to a child whose father recently passed away, and I was recommending that, he talks to the lawyer, gets a living will for his mom at least, now that, she's by herself and everything. And it is very interesting that the lawyers that are working in the court, most of them don't even know about living will. It's super interesting for us because when I referred him that you should go and meet some lawyer, he went, and what do they do is to meet the nearest, the friendliest lawyer that they know of. And the person said, no, I really don't know. I don't think it's necessary, which is very amazing in terms of the fraternity itself not knowing about the things. So, like you said, I think it's a very valid point that awareness being the first thing, and getting all the stakeholders on the same table and then discussing and then putting it across as a solid result via versus just talking about it and then leaving it. So I think that's a very, very valid point. And you also touched the topic of dementia. So coming back to that topic, dementia, as we know, is the most emotionally draining condition, not only for the patient itself, but also for the families alike. It's financially, emotionally, intellectually very stressful. We ourselves at 50 plus have been working with dementia for a decade now, or more than that, I would say, when it started with my grandmother in our house. So you started, and from your experience, what are the three biggest struggles that families faces, especially when they're caring for somebody with dementia? And how can we overcome those challenges is what I would love to know from you.
I think the first challenge they always undergo is denial. I mean, there's a huge denial that actually somebody, my kin, is actually having dementia. So that takes its time, that takes its toll. Second is the toll on themselves. I think there's a huge caregiver stress. They just forget about themselves completely. They're entirely engulfed into taking care of that older adult with dementia. Uh, and not necessarily, I mean, caregiving for a dementia person is a real thankless job in the sense that you don't get anything in back. You There might not be an acknowledgement exactly, or that recognition might not be there. But and of course, to completely, I mean, this is a very important challenge that people have actually not done financial things before dementia has set in. So accounts have been frozen. There have been no joint accounts created. Access has been lost. So I think we always talk about the medical part, but there is a big financial sort of part wherein people, like I have had a person, an older adult who unfortunately died of dementia, but the son and daughter never had access to her accounts. And she obviously had saved a lot. They were visiting, but they didn't really think about having joint accounts in any way, or maybe changing the signatures, or at least have that power of attorney at least. Again, I mean, so heterogeneous. Whereas one of my other older adults, she has a nephew. She doesn't have children, so he basically has a power of attorney. So people have also sort of start thinking. So I think this financial thing is very sort of important. And I think, how do you, I mean, if you have to give the solutions, first thing is to, you have to acknowledge that it's a difficult job. I mean, you have to be on the caregiver side here, because it's not easy taking care of, I mean, whether you have a personal experience or not, taking care of a person with dementia is not very easy. And whatever level, whether it's moderate, severe, mild, the just thinking that that older adult is no more the same person that you knew that person was is difficult. So acknowledge them, give them knowledge. Acknowledge, but give them knowledge. Help them to know better about the disease. Help them to know that dementia is not the end of story anymore. You can still have a life with dementia. The older adult can still have a life with dementia. It depends on how bad the dementia is. Focus should be on quality of life and independence. For the second point, you have to take care of yourself. I mean, that is something I always tell the caregiver, whether it's a friend, family, whoever can give you breaks, you have to have. Ultimately, if you don't, if that older adult's caregiver does not take a break, then it just finishes off. So I always say this. I mean, it's a very popular quote which I say is Swayam Seva Fir Sarva Seva. So if you don't take care of yourself, you will not be able to take care of that older adult. And then a lot of times it can lead to elder abuse as well, unknowingly, because it just gets too much. I mean, you just not able to do it. So you tend to not, don't want to go back to it. Then, and of course, as I said, the financial part, when there is any kind of mild impairment, or when a person reaches a certain age and you can see certain changes, get your memory testing done and make sure that the accounts, the financial things have at least, I'm not saying take it over entirely. No, I'm saying have joint access so that at least you know that you will be able to access them. Ultimately, your kin would want you to have that. I mean, I'm not even saying the money part for you to take care of it, not having access at all. And obviously, people not giving you access for rules, not because they don't want to give it. Obviously, they would not want it to be misused. That is also, I think, very important. And understand that dementia is not the end of story. According to me, that's something we have to tell the caregivers. There is a lot of non-pharmacological treatment there. There's music therapy, art therapy. Uh, I have seen people with dementia have never done any art do brilliant art. So I think enjoy music, enjoy dance therapy. They might not remember the day, but you put the favorite song and they are up in arms, they are actually enjoying it. So I think making sure that their senses are still stimulated is very important. And finally, the caregiver should be made to understand that there is still that older adult of yours behind that. It's the disease that has taken over. That doesn't change the fact that the older adult does not exist. So then it becomes, I mean, they all love their older adults, obviously. It's just that the disease becomes so much intimidating that they tend to forget it sometimes and the disease takes over.
That's true. The disease can be very overwhelming, and I personally, in our experience, also we have seen keeping them stimulated, cognitive therapy, all of this really, really helps to keep them there. And I still remember there was a senior of mine with dementia, and she was with advanced dementia, and she was confabulating those days, barely talking, and So I remember, and still I would go and talk to her for hours together. And I was just telling her my
Yeah.
story. And while telling her, just my story about my dog doing something funny, So I was just telling her the story, and I was just talking that I usually do with her. And then I told her, Auntie, this happened, that happened. And since she stopped, looked at me, she's like, I'm your friend. I said, yes, you are my friend. Why do you call me Auntie? And these little moments of joy, I trust me, the family laughed on it for hours together. But this little moment of joy is, I think, all that they needed in that moment to just
Yeah,
persistently
absolutely.
continue the care.
No, I think it's been very insightful what Dr. Prem has been sharing with us. So, Dr. Prem, as a last question for the today's podcast would be when you spoke about the financial planning and the bank accounts and the kind of children not being wise enough to actually get things in order before a disease like Alzheimer's and dementia happens. So, in a city like Mumbai, Delhi, or probably not even a city perspective as such, but as a regular medical expense vis-a-vis a geriatric medicine expense, is there any difference in the expense pattern? Or do you think we should also plan for the medicinal expenses for older age?
No, no, I think we should definitely plan for medical expenses in older age. And it's a very simple thing. Older adults traditionally have always saved. They always have had savings and they do a good job of it. But the tipping point is an illness. One major admission and then everything goes haywire. So that's why, and of course, or what we were saying was about the access part also as far as dementia and this is concerned. That's a completely different thing, but a tipping point happens here. So that's why I feel, and again, there are so many startups who are focusing only on financial as well now because people have realized. people have realized that that's a very important thing that people don't necessarily highlight. But at the same time, the earlier you work on it, the better it becomes. So I would say people have to be more proactive than reactive. You cannot wait for a disease, you cannot wait for an admission, you cannot wait for an illness. You should have that. That's why getting a health insurance earlier, I mean, if you were wise enough to take it earlier, that's great. There are health insurances for older adults also, but they come with their caveats. The premiums are very high. It's not always suitable. But again, I would still say if you are able to afford, please do take it, because you never know and you are living longer now. So it's not that in 70 you can say that I don't want to take an insurance because the premiums are high, but you might live till 100. You might not get anything, you might not need it also. But that thought process that you have to take only till 30 to 70 is also has to change, because now, I mean, 30 to 60 also at some times, or 65, it has to change. And this is where, I mean, we have also spoken to a lot of insurance companies. You have to have, as care for older adults is very much flexible. Insurance coverage has to be not a standard package. For older adults, it has to be flexible in a way wherein you're able to cater to them. Okay, I understand. Yes, insurance companies also have to survive, but the best possible thing can be given, because ultimately that's what matters, and you will be able to do better. So I think, and remember, care for the older adults who have issues is not easy. So it will never be cheap, because there is a skill involved. So that thought process, which is there are a lot of people that thinking that elder care, older people you are serving or older people you are giving, so everything has to be at a subsidy, might not always be right. That's where I feel the governance should come into. Once insurance comes in, then there is no problem. To be very frank, if everything is covered, then we are all, I mean, if an eye surgery is covered and nobody asks that question to an ophthalmologist, I'm sure nobody is going to ask that question to a person who's taking care of an older adult. But that's why we have to work. So we as a group have to work on giving that financial stability so that they take care of their health better. Or else it will always be that tipping point wherein, okay, if I get ill, then the money will obviously go, and then what happens? And yes, unfortunately, when things are more complicated, the care is higher. So for example, dementia care cannot be cheap, purely because the caregiver is take whoever professional caregiver, I'm saying, for 24 hours taking care of a dementia patient is difficult. Taking care of a dementia patient with behavioral abnormalities is next to impossible. A person who might be hitting, restless, trying to run off, wander off, is not that easy for them to understand that it's a part of the disease and to continue to do that. They have to be paid well, and at the same time they have to give been given that security that they should be beacons, or they should motivate more people to take it up. So one has to understand that, like any other care, if the quantum of care is higher, obviously there will be a cost to it.
Very true.
But it is jointly with various stakeholders, we have to make sure that that cost is taken care in a way that, see, ultimately we have to make sure that everybody gets good quality of care. I mean, we cannot always say that people who can pay only can get good quality of care. I think that doesn't work, or else you're not serving everybody. But at the same time, I feel the onus will be on governance, on us, where we are able to come midway, wherein some kind of insurance, apart from, of course, from Ayushman as Bharat has come up, but apart from that, even private insurance players have to actually buck up in making sure that the larger picture or the larger diaspora is taken care, because we know huge amount of people, not everybody is in the government system. A huge amount of people have take their own insurances and they pay for themselves. Now if we are able to take care of that, then we'll be able to give them better care. And when that happens, obviously we are able to serve them better and they are more at peace. But the finance part, I think, is very important at every age. I think older adults had more wisdom than even all of us in doing the right things. But of course, things have changed. More and more diseases are there, more and more complications are there. I mean, like for example, a fall can change the trajectory of a life of an older adult very quickly. A fit 85-year-old having nothing, a single fall, and the entire trajectory changes. So that's why we should never wait for that event to happen. Financial security should be there, and advice, taking advice about financial independence, even at an older age, is very important. persons giving advice to older adults should also understand that there is experience there as well. You cannot give advice as maybe you're advising a 20-year-old or a 30-year-old or a 40-year-old. I'm not saying respect that age only, I respect the wisdom. So and I mean, if you have seen the movie The Intern, I think that is one of the best examples wherein a young and an old person work together. So I think if the presentation is also done in such a way wherein we have fresh ideas with experience, then the older adult will obviously be able to agree. Or else, I mean, it could be as good as, "Arey, tumko kya pata?" I mean, it can happen. Why not? I mean, a 25-year-old presenting something to an 80-year-old, an 80-year-old will be like, "I have seen thrice your life. And how can you tell me what to do?" But at the same time, there is a 60-year-old also in that room saying that, "No, sir, these are things, he's my..." So then once that stamp is put, so I think we have to think of more and more innovative ways of making sure that older adults trust us to help them.
No, that's wonderful indeed. And thank you, Dr. Prem, for your wisdom, honesty, and especially your commitment towards older adults. I think conversations like this remind us that aging is not a problem to be solved, but it is a phase to be supported instead. And to our viewers, thank you so much for joining us. Please follow us on Elderly Care India and 50 Plus Assist for such more meaningful conversation. Until next time, we continue building a society where growing older means growing safer, stronger, and more supported. Thank you so much, everyone, for joining us today.
Thank you,
Thank
Zach. I would
you.
say aging is a privilege that not everybody gets. So I think that's something which should be best utilized. Thank you. Thank you.
Thank you, Dr.
Thank you so much.
Meghna, and thank you, Dr. Prem. And I think this session has been genuinely very, very insightful, not only from the academic perspective, but actually from the very practical aspects of it. And I'm sure as more people see this kind of podcast, they will actually start thinking, yes, this is what we can do. And surely your inputs will trigger a lot more discussion and a lot more debates, which are practical and implementable. So, really, thank you for coming
Thank
in.
you.
It was a pleasure.
Thank you.
Thank you. God bless.
Thanks for having me. Thank you. Have a good day. Bye bye.